Good afternoon. Thanks for joining us once again. Of course, we're being joined by Dr. Dan Abia, who is a medical doctor residing here in Uyo. Good news reaching the world, I would say, is the fact that the World Health Organization has declared Egypt free of malaria, a journey that they have been on since the 1920s, approximately 100 years, attempting to rid the nation of malaria. We know that malaria, of course, is a disease caused by a Plasmodium parasite of infected mosquitoes. How has a nation been able to achieve this? Is this something that is possible on the continent? That's a conversation we are going to have with Dr. Dan Abia this afternoon. Good afternoon, Dr. Abia. Good to have you on Spotlight Africa.
Good afternoon. It's always good to have you. Can you hear me?
Good afternoon, Dr. Abia.
Yeah, good afternoon. Can you hear me? Good afternoon.
Yes, loud and clear. Good to have you on Spotlight Africa this afternoon.
Same here, same here.
Okay, so we seem to have big news on our hand. A medical breakthrough, as we would call it, something that most nations of the world, especially in Africa, most African nations rather, are expecting. Egypt has been declared free by the WHO of malaria. How do you receive this news? And what do you think, was the build up to this success story?
Oh, okay. Well, it's a journey. It's a very long journey that has started since 1920. It's not been an easy road, but consistency has taken Egypt down there because of the simple modalities they follow. And what modalities did they follow? First, a four-step simple modality. That's what Egypt followed, actually, to achieve a malaria-free society over there. What were the modalities Egypt followed? They followed what we call identification, prompt treatment, vector control, and public education. Those were the strategic steps Egypt took to arrive at a malaria-free Egypt today. It's a very serious and wonderful milestone, coming from the fact that Egypt is in Africa, and Africa, in quote, has been the center of malaria, So Egypt strategically followed those four steps I just mentioned: identification, of course, of malaria cases, prompt treatment, vector control, and public education, or what we call awareness.
So this is something that is actually possible to do, identifying the disease, prompt treatment, but it has taken them a whole of 100 years to be able to get here. And the WHO says before a nation is certified free of a disease, it has to have been able to not have that particular disease burden for up to 3 years. So it's not something that has just happened. So for the last 3 years, yes.
That's why I use the word consistency. Consistently, adhere to these steps that I just mentioned for the past 100 years. Hello?
Yes, I'm absolutely with you. I can hear and see you too. So when we talk about, I want you to further break down those 4 steps that you shared, because when you talk about identification, prompt treatment, one would just think it's something that is easy, and then why are other African nations not, getting on with these steps?
Now, actually, talking of Egypt, they followed going further to break it down. They have what we call short-term goals, mid-term goals, and their long-term goals, okay, which they systematically achieved in these 100 years. Their short-term goals initially was, sharing of insecticides, treated nets, and usage. They engaged in indoor spraying of insecticides or mosquito repellents. Those were their short-term goals. They created public awareness. Those were still their short-term goals. Then, their mid-term goals were, what did they do? They now collaborated with the government. And there was an introduction of what we call malaria vaccines program. There was a malaria vaccination program ongoing. Those were their mid-term goals there. They also partner with, of course, World Health Organization, their Ministry of Health too, partnered with other NGOs in combating malaria. With that, they were able to achieve midterm goals in the fight against malaria. Then their long-term goals were, okay, now that we've been able to share mosquito nets, we've been able to create public awareness, we've been able to, identify the cases and put data in place that, okay, this is the number of people that have this, that are affected by malaria yearly. They now approach the government with their long-term goals, which were to achieve coverage for this data that they already have on ground here. They now target the endemic areas in which they knew, okay, these are the number of supplies we are sending to certain areas to battle malaria. And this was made possible by collaboration with the government.
So
they now made laws. Hello?
Go ahead.
Okay. Then they now approach the government to create laws and enough awareness to make it possible that the citizens are aware on what to do. They were able to strengthen the health workers. How did they strengthen health workers? They made sure they employed more health workers that were battling, in the sector of malaria awareness, malaria treatment in those communities that were endemic. So with all these apparatus put in place, they were able to achieve results. But of course, over time, it's a process that takes time. But the government was part of it. For it to be sustainable, you have to bring the government on board.
This is great. Nigeria has about a 1.5 million disease burden for malaria alone. And we know that, Nigeria is one of the endemic nations in Africa to malaria, as it were. But these steps you have mentioned are things that we know that are also being practiced in Nigeria. How well would you think that we are progressing in the journey of eradicating malaria? And I must say, to a layman, it is a surprise that diseases like malaria can actually be eradicated from nations. What's the possibility window for Nigeria and the rest of Africa?
Okay, it is very, very possible for Nigeria to arrive at what Egypt has arrived in, or to be malaria. The problem is, over the years, we've not been consistent enough. The progress has been slow, because for us to achieve this, we need consistency from health on the part of health workers, on the part of the government. We have not. There are still villages. There are still villages in rural areas that are not aware of malaria. They are not aware on how to combat malaria. They are not aware on the things to do, even to eradicate malaria in our surroundings. There are still villages that still leave things like stagnant water around. There are still villages whereby houses are so close to the bush, surrounded unhygienic conditions of where people live. And these are the things that breed mosquito, that give birth to malaria. So in Nigeria, I think although awareness has been made so far, but we have not made enough awareness. There's still a lot to do, even in the area of awareness. Towards this, there's still enough to do, a lot to do. So Nigeria is progressing, but the progress is really slow in this. And another thing too that we are lacking behind is we need more health workers on board. For a population of over 200 million people, we need more health workers to tackle this epidemic. We need more health workers on board so that health workers can be sent to these communities, the rural areas, to create sensitization. We also need, although I know we have a lot of government agencies now that are actively working on, the malaria issue in Nigeria, but there are still some communities they need to still reach out to. Things like mosquito nets has not gone round. The government has been sharing, no doubt, but it has not gone round yet.
And we cannot even certify those that are using these mosquito nets after getting them from the government. A lot of Nigerians will not use it. Some people use it and then they go ahead to plant with it. But let me just ask you the last question. There's beginning to be a build-up and conversations around malaria vaccine, which seems to be, on the one hand, another breakthrough for the disease burden. But do you think, what are your thoughts about malaria vaccines? And do you think that, we should all lean in expectation to the vaccine? Or are there other steps that, we can better use to eradicate this disease burden as opposed to just vaccinating when eventually it becomes certified?
Okay, outside we cannot just lean to using even Egypt's modalities. We cannot just lean, they didn't just lean to, because actually, why am I using Egypt as a reference point? Egypt is Africa one. So there's a very high chance that what has worked for them will also work for us. They have the population too, just like we have the population, even more here. I believe that if we want to achieve success, we cannot just lean to vaccines alone. Things like mosquito nets must be shared across board. Awareness is very important, because one thing is sharing mosquito net, another thing is the people knowing how to effectively use it. Another thing we're also lacking behind is vector control. That is controlling these insects. Because once you don't create a comfortable environment for the insects to have shelter, they will not have shelter. So if we make our environment unconducive for these insects to dwell in, that's a point. That is one major step in eradicating it. We cannot, vaccination alone will not get the job done. That's the point I'm trying to make.
So, but Egypt said they had to cut down on rice. What are we going to do if we have to take out the staple food, that most Nigerians eat? They cut down on rice production and all the likes. It seems, production of rice breeds a lot of mosquitoes. Okay,
but you can also bear with me that rice production is not done everywhere in Nigeria, right? Rice production is not done everywhere. And we have pesticides and things that can be used to even control the mosquito. And I can tell you for free, rice production is not the reason why we still have malaria in Nigeria. That if enough awareness is created, if things like mosquito net is shared cross-board, if things like vector control is put in place, stagnant water, keeping a hygienic environment where people live in, it will go a long way to reduce malaria incidents in Nigeria.
All right then.
Malaria, rice is just one small percentage of it.
Okay.
In Nigeria's case, we don't necessarily have to cut down the production of rice. We can produce rice in a more controlled environment. We have pesticide controls now. So farmers that are engaging in rice production can be taught methods on how to effectively, control these vectors around where they are cultivating rice.
All right then. Thank you so much, Dr. Danabia, for explaining the journey to Egypt becoming one of Africa's nations to be rid of malaria. It's been a good conversation with you this afternoon. Thank you for your time.
Thank you very much. You're welcome anytime.
Thank you very much. Well, congratulations to Egypt, and there's a great hope for the rest of Africa. We can actually eradicate one of the strongest disease burdens on the continent, malaria. I hope that nations of the world keep working towards this. Thank you so much for being a part of the conversation on Spotlight Africa this afternoon. My name is Uyai MM. Do enjoy the rest of your day.